the day 2 of the expert group meeting of the United Nations expert group meeting on the impact of COVID-19 pandemic on census taking in the world. This is the second day of the meeting, and we are again sending very warm greetings from New York to all over the world, and we are welcoming you to this second day of this expert group meeting. By way of just setting the stage for today, allow me to just point out a few of the discussion that we had yesterday during the first day of the meeting. We did go over several points yesterday. The first one on the state of the art of census taking at the current moment, and the difficulties that are documented through a series of mechanisms and instruments that the UN Statistics Division developed in order to monitor census taking and the implementation of the 2020 World Programme on Population Housing Censuses. We then moved to the particular examples of countries and how they coped with the pandemic in terms of making sure that the census has been conducted according to the international standards and all of the quality assurances. We did hear from Ghana that conducted the census, although being postponed. They conducted the census in June 2021. That went well, and they did the post-enumeration survey. They also provided an overview of the questions that could have been possibly adjusted and that would reflect a better understanding on the impact of the pandemic in Ghana. But because of the fact that the questionnaires have been established long before the pandemic, that was not essentially possible. Then we heard from Nepal, which is undertaking the field work in later this month. The fielding listing is accomplished successfully, and it is a door-to-door canvassing of the whole countries, primarily with paper questionnaires, with certain urban areas covered by the CAPI, and some of the internet self-enumeration for the consulates and embassies abroad. Again, Nepal, although they postponed the census, they did for 5 months. They did have a very narrow possibility of adjusting the questionnaires and the questions. So, and again, this is something that could not have been done in that short period of time. They expect to have not relatively, but quite successful field work with all the protection measures being put in place. We have then heard from UK, more precisely from the census in England and Wales. And here we did learn that since vast majority of the respondents use the online questionnaire to respond, 89% of the response came via the online questionnaire, that provided an opportunity not to adjust the questions per se, but then to provide additional instructions that would guide the respondents in order to better understand the meaning of the question and to take into consideration the effect of the pandemic, especially from the issues related to work, related to the place of work, commuting, and so on and so forth. Then we had the presentation from another presentation from UNSD that was focusing on what we have documented in terms of the needs of the usership at this point of time. There is a huge pressure, and there was yesterday, if you have perhaps paid attention to the news, there were a breakthrough news that some of the assessment of the number of deaths due to pandemic exceeds 5 million worldwide, but that is a huge undercount according to a number of experts. We on this side of the United Nations, we teamed up with WHO. We put together a technical advisory group, and one of the biggest demands is how to best use the censuses to get some of the information about mortality due to COVID-19. So we elaborated a bit on the possibilities of improving the questionnaires, especially in some categories, in order to get a better understanding on the impact. Then we had a discussion that was really, and questions, of course, that are really quite fruitful. I would just draw one conclusion that I believe has been very clearly outlined. That is the fact that changing the question is extremely difficult, requires testing, and requires rigorous testing and understanding of the consequences, and so changing of the questions should not be approached lightly. On the top of that, changing the question right now in the context of already the legislative framework for the censuses would not be actually possible. At the same time, we are also outlining that the countries may take into consideration some of the modification in terms of not changing the questions, but in terms of making the categories more precise, especially referring to, for example, the date of birth and the date of death in the case of mortality. If the question is asking the census, that could provide some additional information that is not available right now. So that was yesterday. Today we are turning our attention to session number 4. The session number 4 focuses on major changes in census procedures and operations to reduce the impact of COVID-19 pandemic or to cope with it. What we want to achieve here in this session is to learn from countries that conducted the census or are about to conduct the census. What are the measures that they undertook in order to make sure that the census would be successfly conducted, and whether the countries modified the original activities, and if they did, yes, if they did it, to which extent. We will also discuss some technologies and procedures used for reducing face-to-face interviews and for improving population coverage. I would just like to outline that in one of the early recommendations from the Statistical Commission, the decision to switch the methodology for data collection and the field work in the middle of the census due to pandemic should be approached very cautiously and only after a thorough testing and rigorous screening of the procedures. We will also learn to which extent the countries were using alternative sources of information to fill the gaps, and we do expect to have extensive discussion on the benefits and challenges of redesigning census activities. This is something that is indeed of a particular importance. We will have presentations from Australia, China, Chile, Croatia, India, Italy, Portugal, South Africa, and Zambia, and this is by alphabetical order, which is the usual way that we are conducting our meetings. What I would suggest is that we are hearing 3 presentations, and then we can break for discussions and questions, follow-ups on the 3 presentations. And in 3 batches, we will then have covered all of the presentations for today. So this is what we intend to do. Should you have any objection or comment on the way that we are going to proceed, or any other issues, please, the floor is open right now. Thank you. I see no hands raised. Therefore, let us proceed, and then we will start with Australia. Would you please take the floor and share your screen? We cannot hear you. You are muted.
Sorry.
That's all right. Please go ahead.
Thank you, Chair. My name is Georgia Chapman. I'm the. Sorry, I'm getting echo. Is that just me? That better? No.
We are hearing you quite well.
Okay, I'll just. Oh, there we are. The echo's gone. So My name's Georgia Chapman. I'm the Acting Program Manager for the Census Field Branch for the Australian Bureau of Statistics. Before I begin, I would like to acknowledge the traditional custodians on the land that I am meeting on today and pay my respects to the Wurundjeri people of the Kulin Nation. This is our Indigenous community that have lived and cared for this land for generations. I pay my respects to elders past, present and emerging. I'd like to take this opportunity to thank you for having me here. I've got a brief presentation and I will go through some background so you have the context of what our census looks like to inform the questions. So to start, few census fast facts. So our census night was the 10th of August this year. We run a 5-yearly census and it's place of enumeration, so where you were staying on census night. And the form for the household can be completed by any responsible adult. It's our first census since 2006 with new content. We asked about health conditions, long-term health conditions and service with the Australian Defence Force. And it was a digital first census and nearly 80% of our response was online. We did actually have a very strong early response, and this required a change in tactics for non-response follow-up. Good problem to have, but I'll talk about it a little bit later because it did compound the COVID situation. And at the time of our census undertaking, more than half of our population was in lockdown. And that meant that the substantial changes that we had planned in the worst case scenario of lockdown had to be enacted. And that did need a change to fieldwork and how we counted special populations. Our enumeration closed the 1st of October, with a few exceptions in some harder areas. But we are really pleased to be able to say that our overall response rate will exceed our 95% target. And we're looking at most sub-targets to be met, but are still in the processing phase. So we can't say for certain what those sub-targets and how they look at the moment. For our census, we encouraged all people in Australia to complete the census online. Majority of households were delivered a letter with a unique login ID, and they were asked to go online or call up or request a paper form to complete. We did provide paper forms to anyone who asked for them, but in more regional areas of Australia, we delivered them up front. And we had special processes for those experiencing homelessness and for those in communal establishments such as hospitals and hotels. They were more targeted and tailored to the unique circumstances. Australia is a big country, and this is a bit of a breakdown of what model we had for the different areas in Australia. So just to give you a sense, our remote strategy which is the pale yellow, that is, they were roving teams that travelled around remote Australia offering interviews, predominantly Aboriginal and Torres Strait Islander populations. There are Indigenous communities here. Our drop-off where paper forms were delivered is the blue area, and our mail-out, which was 85% of the population, is those pink dots. So it shows how populated our cities are compared to the rest of the country, which is quite sparsely populated. And our enumeration timeline. So people receive their census instructions before census night, and they're encouraged to complete as soon as they know where they're going to be on census night. After census night, we send a reminder letter to people who haven't, or households that haven't completed, and we start following up with visits in person. We increase follow-up visits throughout the end of August into September, and towards the end of the enumeration period, we provide all non-responding households with a final reminder letter and a paper form. And if there's any refusals, we do follow up refusals to more strongly to request completion. Our strategic reporting dashboard does show we did have an early response. So the light blue line here shows how our response actually happened compared to the blue, which was our forecast response rate. Census night is this first line here. So this shows how much more, how much higher the response was at census night. And this did cause a bit of a concern because we didn't want to lose momentum after census night. One of the theories is that a lot of people were in lockdown, they were at home, didn't have as much to do, so just did what they were asked to do and jumped on and completed online quite easily. And because it was just something that they didn't have their busy lives like you do when you're not in lockdown. So getting on to undertaking a census during COVID. The model that we have, which is predominantly letter-based for 85% of households, means that the majority of households don't actually have any contact with a census officer. This is particularly it's good from a cost-saving perspective. It means we can invest in supporting people who require more assistance and invest our money there. However, from a COVID perspective, it really does, it did help us to be able to reassure the public that if you just go online and complete or send your paper form back, you won't actually you won't be followed up by a person. So that was one message we were able to give. But it meant that with such an early and high self-response, there wasn't as much follow-up that had to be done. We did have to continue to adapt our approach to suit the local circumstances. Each of our states and territories, they all had different lockdown rules and different durations and different regulations and police and government. We had to go through different governments to get authorised an essential worker status, and it wasn't just an easy national approach we had to take. Australia's one of our I don't know what wave, second wave came through around census time, and that was it did mean that progressively throughout enumeration more and more of the country went into lockdown. At the start, it was a fair bit of work getting staff in and out of the field and changing procedures as we were going, but we became quite efficient and effective at the end. To do this, very early on in the COVID landscape, we developed a step-down plan, and this was a three-step COVID plan where we went from it goes backwards, but step 3 is the top step. It's our standard procedures, close contact, so allowing people to sit down with someone, assist them to complete the census, and sharing a closed space. So that was everything in step 3, which is no lockdowns, no COVID. We can conduct business as usual. If there's any form of government restriction and COVID in the area, we stepped down to step 2, which was casual contact. This meant that we could knock on the door and have a quick chat to the public, but we wouldn't be offering any sort of face-to-face assistance that would be longer than a conversation over 15 minutes. And we would make sure that our field staff felt like they could opt out. If they didn't feel safe, we did not force anyone to go into the field. And if the jurisdiction was in a full lockdown, we moved to contactless, which meant that we had no planned face-to-face with any member of the public, and we minimised any unplanned contact. We hand-delivered census information to a letterbox or the door, so our field staff did not knock, did not make contact. We did not interview any rough sleepers people experiencing homelessness on the streets. We observed. So there was absolutely no contact in a lockdown situation. And as I mentioned earlier, over half our population was in lockdown over census in the end. So the impact of COVID-19 on enumeration. For rough sleepers, so people experiencing homelessness, we usually collect through face-to-face interviews using people from the homeless who understand and have experience working with people experiencing homelessness. We implemented one of three options depending on the jurisdiction: delay rough sleeper enumeration by up to 2 weeks, collect the information via observation if we were in step 1, so we weren't able to have contact. And in Sydney, New South Wales, we had such a strong lockdown that the government didn't want the homelessness team out in the field at all. And so we worked with the government about what administrative data that would be appropriate for us to be able to substitute in. We weren't going to push to go into the field if the government, and we didn't have the government support to do it. Residential aged care facilities and some other facilities looking after vulnerable populations. There were no visitors allowed in our aged care facilities or hospitals, and we didn't want to compromise the health of our field staff or the public. So we did simplify procedures so the hospital staff weren't overwhelmed or the aged care facility staff weren't overwhelmed, and we enhanced the summary form and collected more information, a minimum set of data on the summary form rather than requiring them to get individual forms back from the individual people in the dwelling. It was better to get a minimum data set than to get really patchy information, we determined. We weren't able to offer face-to-face support in areas that were locked down. So that would be someone who speaks a language other than English to sit down and help complete the form. We did up our social media messages on about how to seek help from someone known and trusted, and we undertook to develop a range of complete your census videos in a number of languages about why the census is important and the questions. And what the questions mean. Our remote communities, so our Indigenous populations, we actually had to cease operations during lockdown in some areas due to safety concerns. And one community, we weren't actually able to deliver any materials and they weren't even enabled to self-respond. We actually have worked with the council and will be going back into that community in 2 weeks' time to undertake census activities so that we can hand on heart say we have delivered and provided census materials to the whole of Australia. We weren't able to follow up face-to-face contact in Greater Sydney and Greater Melbourne, so our two biggest cities in Australia, and that we know that we couldn't determine occupancy. If you can't knock on a door, you can't say whether the dwelling, you can't know if the dwelling is more likely to be occupied or not. And so we are going to have to work in the processing side to work out that occupancy more so than we have done in the past. What have we learned? We learned that we need to plan to be flexible and plan for the worst. We definitely made sure that we were prepared to know what to do if there was an issue or a crisis or if there was a COVID lockdown. What we didn't plan for was the stronger response rate, partially potentially because of COVID as well. And so in the combination of those, we were able to adjust how we operated, working all together to understand all the implications. We were able to adjust our enumeration methods. We were able to move training online. We were able to do things that if you'd asked us 18 months ago, we would have said, no, that's not possible. It's such a big operation. It's the census. You can't change that. And so we decided, like, that's something we've learned, is that we can investigate some of those things that we've never touched just because it's been done that way before and we know it works. And we are going to take that mentality moving forward into the 2026 census and beyond. Is what did we learn? How could we adjust our census based on what we learned? And how can we use this as an opportunity, not just a challenge? And that's it for me. Thank you.
Thank you very much, Ms. Chapman, for this very comprehensive, really overview of the challenges that you had in running the census in the midst of the pandemic in Australia. I believe that this is going really to be extremely useful for all of our colleagues worldwide. We will, of course, have a possibility of following up with questions and discussions on the presentation by Australia. We will now move to the second presentation from Republic of China. China, please take the floor and share your screen. Miriam, did we have a confirmation from our colleagues from China?
Yes, we did, and we received the presentation. So
very well. We will then move with the next countries, and then we will get back to China once we establish a contact with them. Chile, are you ready to present?
Yes, we can present right now.
So please go ahead. The floor is yours, and please share your screen.
So can you see my presentation?
Yes, we can see. Perfect.
Great. Thank you, Sirjan. Good morning for everyone. I'm the Deputy Technical Director of the Chilean Statistics Institute. For our institution, the opportunity to attend this meeting is of great relevance because it provides us with a space to exchange our experiences and strategies in confronting the health and economic crisis triggered by the COVID-19 pandemic, considering the impact of the pandemic in the population and housing census, and the main changes that we have introduced in census procedures to reduce the impact of the COVID-19 in the operation. So thank you for including us in this discussion session. The COVID pandemic has had a strong impact on all statistical operations of our institution, including the population and housing census and the agricultural and forestry census. Both operations had to be replenished given the travel restriction as well as the COVID infection rate, which peaked in 1919. In this presentation, first, I will describe the general design of the population, of the next population and housing census, then summarize the overall effects of COVID in Chile, and finally address the effect of COVID on the census planification, focusing on census activities and the measures that we have implemented. So our methodology is considered that our original plan will consider that the year of execution of census was 2022. And the methodology that implemented is a traditional census considering the jury resident definition. The period, the application period, the field was considered 12 weeks. And the field strategy considered main methods of direct face-to-face interview using mobile capture devices with data plans. And as a complementary method, we consider digital self-enumeration and e-census to complement the first one. The enumeration. Yes?
Leonardo, sorry to interrupt you. Are you having a PowerPoint presentation, or because what we are seeing on our screen is a text file?
Ah, sorry. So you are seeing my work, not my presentation.
That's
Just
right.
Give me a second to
Okay.
change.
Thank you. Thank you very much. Please go ahead.
Okay. Just give me a second. Now it's all right. Can you see my presentation?
Yes, it is right. Yes, it is a presentation now. Yeah.
Great. Thank you.
Thank you. Thank you. Please go ahead, Leonardo.
Yeah. So the enumeration team considered 20,000 persons, considering 16 paid enumerators across 600 offices along the whole country. The update of pre-census cartography, to do that, we consider the use of administrative record complemented with a partial coverage of the territory using MCD with data plans. Our estimated population it's about 20 million persons. So that is the total population that we have to cover with our operation. So consider the effects of COVID in Chile. Here we have the main impacts of the pandemic. This slide shows some important milestones implemented by the health authority to deal with the pandemic. Now we can see that in 2020, we had in the 18th of March, the declaration of a constitutional state of emergency. Then, some days after, we started with the beginning of a nationwide curfew from 10 p.m. to 5 a.m. And that was at the beginning of the pandemic. Then in July of 2020, we implemented, the national authority implemented a strategy of step-by-step plan, considering different timing and imposing dynamic quarantines in different communes of the country. And in 1921, we started at the beginning of February the vaccination process. Then in May, we implemented the mobility pass that allow us to have some more or to reduce the additional restrictions. Then in August, we beginning with the booster dose, the second, and then in September, at the end of September, we end of the state of emergency and the curfew. Also, you can see some statistics consider the impact of the pandemic. For example, we have the number of the number of persons diagnosed by COVID. It was more than 1.5 million by the end of the October. So if we consider that we have a total population that is close to 20 million, that is a lot. It's a high impact in our society. So if we take, we have a look of the effects of COVID disease of the population and housing census of Chile. The first impact that we have to in 2020 reprogramming activities because of the complex sanitary situation, restriction or mobility based on a high rate of contagion. The use of ICU beds was very high, and the number of deaths. So field work could not be executed, and there was uncertainty about the effects and the duration of the pandemic. So this uncertainty about how and when we would be able to collect information in the field and about the population reaction to a face-to-face interview with an enumerator, consider the health emergency, the restriction of circulation and mobility, and the stay-at-home order, we have to reprogram the activities. So we're introducing changes in the task planning. So the face-to-face pilot study in 2020 was replaced with a web-based pilot study for public officials. We focus on the public sector to apply this testing plan. And also the activity considering the opening of the census questionnaire to organization of indigenous peoples and the Afro-descendants. We have to reallocate it in time. The initiation was delayed and its duration was also extended. The execution strategy at the same time was changed from face-to-face to virtual, with strong support of municipality and other public services to run out this process. Also, we have an impact on the training of operation staff. Sorry. Considering the risk of contagion in face-to-face training and the limits of the number of people in closed spaces, we're working on incorporating virtual communication during the training period, in addition to after the training period, in order to reinforce the contents during the enumeration as originally planned. In this way, we could adapt to the health circumstances during the training period. You are not seeing my presentation right now?
Milton.
No, we lost the presentation.
No,
We
it's
lost the
not
presentation.
Oh, sorry, again.
Re-upload again.
Okay,
Okay, now it's fine. Go ahead.
we are here. Thank you. So the other impact in our planification was that we have to reduce our budget. So we count with fewer economic and human resources. A 30% of budget cut, an indication of the state of austerity, impeded the originally planned increase in the size of the team. So that was a high impact in the first planification. And also the introduction of telework created complication in coordination for the entire project team. So consider that all these restrictions implemented, we have to change the year of the enumeration from 2022 to 2023, formalized in October 2020, and a complete reprogramming of all other activities. So this change in the date of the census enumeration was officially announced in the media, forcing a complete reformulation of the project planning and the addition of completely new expenses, such as masks for operational staff, and the increase in other expenses, such as the number of vehicles for operations, considering the limitation of the number of passengers per car, and so on. Also, we implemented a modification of the design to include the exploration of a complementary telephone assisted collection method to facilitate the response to the pandemic, to facilitate the response of our interviewers. So we introduced also the possibility that the people can answer the census by telephone assistant operators. Here you have the vote planning. On the bottom side of the slide, you have the original planification without the introduction of COVID. And on the top side of the slide, you have the changes that we implemented to deal with the COVID pandemic. The year, as you can see, the year 2020 was key for testing and defining operational, technical, and methodological aspects of the census, in order to carry out with the large general test of experimental census in 2021, 1 year before the census, are recommended by international organizations. So here on the bottom side slide, part of the slide, you can see that in 2020 original, we have to plan a face-to-face test, census questionnaire stage, considering an intercultural participation, and by the end of the year, a multi-mode test in 2020. So in response to COVID pandemic in 2020, we did a remote test in the middle of the year, and we maintained online communication with indigenous and Afro-descendants organizations, leaving the 2 pilot tests from 2021. The experimental census and the cartographic updates for 2022 and the census itself for the first half of 2023, the schedule is going according to plan. We have already conducted the test with enumeration, executing a questionnaire face-to-face, and we are starting another test that has complementary response method by telephone and self-enumeration. That is in here that we call multi-mode test. We are running that multi-mode test this month at the end of the year from September to December. In 2022, we have to run the experimental census from April to May, and we have to update the pre-census cartography from May to September, and then in the beginning, at the beginning of 2023, we have to start the census, considering the first months of the year, the first 6 months of the year. Currently in our country, we no longer have mobility restriction at night or between communes and regions. Currently, a significant proportion of populations has already been vaccinated, and children are now being added to the process, as are booster doses for adults. However, infections are rising again, so we cannot say that we have completely overcome the problem. So what we have learned, that our experiences have shown that our planning must be flexible enough to adapt to changing circumstances, and that our technological component must be greatly expanded to make census feasible. That's all. Finally, I would like to thank you for your attention and thank the United Nations for organizing this activity, which has provided a valuable opportunity to reflect on the production of official statistics and to share with other producers what we are doing to deal with the COVID-19 pandemic. Thank you, Sergey. Over to you.
Thank you, Leonardo. Thank you very much for this extremely illustrative presentation on the radical impact that the COVID-19 had on the census preparations in Chile. I believe that your slide 6 is really telling the whole story in the most succinct manner. And this is also something, again, that we are learning as a kind of experience that will benefit our colleagues worldwide. We will now move to Croatia. Croatia, would you please take the floor and share your screen?
Hello to everybody. Dear colleagues, good afternoon, or maybe good morning, wherever you are. Okay. Hope that you see the presentation.
Yes, please go ahead.
Okay. Well, I'll try to be as much as possible simple, brief, and clear. In the presentation, I will try to present the challenges we faced during the census activities, and especially during the field data collection. First of all, let me introduce myself. My name is Damir Plesac. I'm coordinator of the 2021 census. And Ms. Dubravka Rogic-Hadžalaić prepared this presentation. She is on the head of the social statistics. First, let me say that our Census 2021 is still ongoing. So the field work will last until 14th of November. Therefore, there is still a lot of work to be done, but we would like to take this opportunity to provide you with basic information concerning 2021 census in Croatia, as well as COVID-19 influence of the census 2021 implementation. During the preparatory census activities, due to the COVID-19 pandemic, the main difficulties in conducting field censuses work included changes in the epidemiological situation from day to day affected our plans and activities. This had potential implication of restrictions of intrastate mobility, which could have negative effects on activities at regional and local levels, such as planning of distribution of census equipment, and this situation did not occur. But however, it was something one had to take into consideration. Online education has been prepared and implemented, and this was the first time an education for census was done online. Education of enumerator lasted for 4 days, and it embedded Census 2021 methodology, Census 2021 IT application, and some organizational aspects. Online education proved to be somewhat difficult when it comes to assessing the level at which enumerators have attained necessary knowledge, as it would be the case in face-to-face education. Some enumerators had difficulties to connect to virtual education, as well as certain number of controllers. Their primary duty was to supervise the work of enumerators. In those cases, additional educations were implemented. In addition, education material was recorded and it was accessible to all census participants. Furthermore, work from home of the entire census team, which was inevitable at certain points due to the COVID-related restrictions, affected the optimal productivity and strength of the teamwork. Consequently, some adjustments were needed. Most meetings and presentations were held online, and conversations and discussions were often conducted over mobile phones. And there were no usual face-to-face meetings, which were usually more fruitful. Before the very beginning of the census field enumeration, the epidemiological situation significantly deteriorated, and the Civil Protection Headquarters of the Republic of Croatia reached the decision that census enumerators must have EU COVID certificates. Due to such situation, protective equipment, most notably masks and disinfectants, for enumerators who would collect data in the field had to be planned and obtained. In addition, for those enumerators which were not vaccinated with COVID-19 vaccines, CBS had to ensure PCR tests. This had to be done in the relative short time and short frame, and those enumerators had to be tested every 48 hours. Those who were not willing to do so had to subsequently withdraw from the census activities. Following the epidemiological situation in the country and beyond, some adjustments had to be made with regard to certain census activities, and consequently changes in the legal framework had to be made with regard to the reference day. So initially it was set at 31st of March 2021. A new reference day has been set at 31st of August 2021. New data collection methods were introduced for the Census 2021 enumeration, namely CAVI and CAPI data collected methods. Funds for the purchase of COVID-related protective equipment had to be secured, which led to certain changes.
Mr. Damir, you are muted. We cannot hear you.
Okay, sorry. Am I now on?
Now it's fine. Now it's fine.
Okay.
Please go ahead.
Okay. Let me see. What did you hear and what you didn't hear?
So we are, you mentioned introducing the CAVI and CAPI methods of data collection, which was an additional one. So if you can take it from there.
Okay, and yes, and communication with the general public was adjusted to provide information on steps which were taken to enable epidemiologically safe implementation of the field enumeration. In relation to data collection methods, two methods were applied, so CAVI and CAPI methods. From 13 to 26th of September 2021, population was given opportunity to self-enumerate via a web application through the National Electronic System e-Citizens. E-Citizen system was established by the government of the Republic of Croatia with the aim of modernizing, simplifying and accelerating communication between citizen and the public sector and increasing the transparency of the provision of public services. One of its main features is that it allows every citizen who has a valid personal identification number to receive official message related to public services, procedures and status and their review, management and storage. By using CAVI method, a person listed himself or enumerated himself, members of his or her household, and the dwelling in which he or she lives. Benefits of the introducing CAVI method are a safer environment in the circumstances of COVID-19 pandemic, the positive impact on implementation costs. Citizens were able to enumerate themselves at the time of their choice. Respondents might answer to the questions without restraints, which might emerge when the interviewer is present in the household, etc. From September 27 to November 14, enumerators are enumerating population in the field with the help of laptops. That means the CAPI method is still ongoing, as I said a little before. In the process of self-enumeration, citizens had the opportunity to fill out a digital questionnaire about their dwelling and household, as well as all members of the household. One reference person provided all the data for one household. That is, you as an e-respondent are expected to fill in the questionnaire with identification data, as well as data on your dwelling and household, and data on all members of the household. National e-Citizens platform was used, and it was very well received by the public. Around 40% of population have been self-enumerated, and this was somewhat of a pleasant surprise for the most of the Croatian Bureau Statistics staff, as standard surveys implemented via CAVI usually generate much lower response rates. This also indicates the fact that the census is a specific statistical activity. Help desk was organized, where citizens have been provided with all the information about the census. most questions were about the permanent and usual residents, as well as whether Croatian citizens who live abroad need to enumerate themselves and under which conditions. Due to the COVID-19 pandemic, the Census 2021 was implemented with a public health security protocol. All enumerators had to have COVID-19 certificate. As stated before, COVID-19 certificates ensured that the enumerator was either vaccinated, recovered from COVID-19, or has been tested in the regular intervals. In the field enumeration phase, each enumerator has been responsible for certain enumeration areas. For this census round, somewhat less than 8,000 enumerators were enlisted, and they were supported by around 1,000 supervisors. Apart from the Croatian Bureau of Statistics, the bodies of local and regional self-government participated in the organization of the census. And their task mainly consisted of provision of logistical work, for example, ensuring facilities for IT and other census equipment to be stored, transportation of the equipment, participating in the procedure of recruiting the enumerators, and so on, as well as census promotion in the public. The survey is based on a statement, so the enumerator is not allowed to request identification documents from citizens. I will talk at the end of the presentation about the post-enumeration survey, just a few sentences. So in 2021 census round, along with the post-enumeration survey, also the administrative sources could be source for measuring the census coverage. The coverage control will be carried out on the sample containing 300 enumeration areas or 1.4 households in the Republic of Croatia. It will cover all NUTS-free units in Croatia, that means 20 counties and the city of Zagreb. Croatia aims at starting the PES as soon as possible after the census, because, of course, the shorter the time between the execution of the census and post-enumeration survey, the better PES quality should be achieved. Training of the enumerators will be carried out several days, and enumeration in the field will start a maximum 10 days after the completion of the census 2021 in the field. The aim of the control of the coverage of enumeration units is to check the coverage of all enumeration units and their correct allocation. It will last 7 to 9 days. And also the aim is to evaluate the reliability of responses to particular questions from the enumeration questionnaires. That's all from us. So just to maybe to point out that our census is still ongoing, and it will be finished by 14th of November. Thank you very much.
Thank you very much, Croatia. Thank you, Damir. Another very illustrative example of the impact of COVID-19 on the census taking and the adjustments that Croatia took in the process in order to make sure that the census is completed to the highest quality possible. So thank you very much, Croatia. We have heard now from Australia, from Chile, and from Croatia. We have heard the three examples on the adjustments that took place and the impact of the censuses in the case of Chile, really a crucial one. So I will open the floor for, of course, the follow-up questions and discussions. Prior to do that, allow me just to check the chat box. We did have a few questions for Australia there regarding the definition of rough sleepers and homelessness. I believe that these have been addressed, but then Georgia, if you wish to address this, please do so. Then we have the question for Croatia. Why the referendum day of 31st August if the enumeration started only on 13 September? So that is for Croatia. And the second one for Croatia, how did you provide a hand-on experience to enumerators to use CAPI? There is another one for Australia. How could you collect address of all the households in the country? And what strategy was made to ensure no omissionary duplications in this process? And then there is another question from Croatia at this point of time. Do you link responses from the PES to the census itself? I believe this refers to the matching of the records from the census enumeration and the PES. So please, Australia and Croatia, note these questions. And then I'm now opening the floor for any other questions to any of the presenters. I do have a hand being raised from Ms. Prendergast. Would you please take the floor and introduce yourself? Ms. Prendergast, you have your hands up.
Sorry, it's an arrow.
Oh, well, okay. Thank you. So the floor is open for any questions to Australia, Chile, and Croatia, aside from those that are already mentioned. Very well. Australia, let's try to start to commenting on the questions. So there were questions about homelessness, and then the question on how do you ensure you have a full address registers in Australia and know the location of the households. Please go ahead.
Thank you, Chair. So there's a bit of discussion about homelessness. So in the chat, but just to summarise, we do rough sleepers are people without a dwelling, and this is we need special procedures because it is the census of population and housing, and the houses or the dwellings are our frame. So we need to make sure not only they need providing additional assistance around language support, it's also about making sure we actually capture people when we are all about the households as the frame. I did also note that there was a government policy decision to move people without a home into hotels because we didn't have tourists, and this caused other complexities because it's harder to identify for our homelessness estimates if they're in a communal establishment that's not traditionally used for people experiencing homelessness. So we're doing a bit of work with service providers and governments to understand how many of those people have been moved in. There is a question about our comms campaign there. So that was our communications strategy. We didn't actually change our paid advertising campaign due to COVID. We did bring some of our messages forward earlier. We brought the compulsion message in earlier, but that wasn't so much due to COVID. It was because of the stronger earlier response and wanting to keep the momentum going. But we did make sure we addressed COVID in our all of our non-paid media. So all our spokespeople had talking points about why COVID, it is so important to collect a census even though COVID is occurring, because a number of people said, well, this isn't representative of who we are normally, or this is a, how can you, why are you asking me about my journey to work when I don't have work due to COVID, or my journey, I'm working from home? And UK actually addressed that. I loved what the ONS did in their census form about that. We put those messages on our website and our spokespeople talked to them. And we also promoted about the census is a snapshot. It isn't about being, there is no representative point in time really as in terms of this is the environment we're in, and it's actually more important than ever to get a snapshot to understand how we rebuild in 5 years' time. Although some of the data the utility of it will be different to what we planned, such as our transportation industry is going to be a bit upset because it isn't going to be able to be used for transport as much. But in short, we didn't change our communications beyond just being able to talk to the questions the public had. And finally, frame questions. How did we collect the addresses of the households? So it depended on the area. In our most populated cities, we had an address register, and this is sourced from other data sets nationally into a frame of addresses. We did a lot of quality assurance to understand duplicates and aliases, so corner blocks, particularly a problem in terms of having two different numbers, street numbers. And we used the frame from the 2016 census through to the 2021, so there's lots of cleanup that's happened. For non-cities in the regions and remote, the address quality isn't as good, so our field staff actually create the frame as they drop off materials. This reduces duplication, and it means the form is linked to that household, and that household is likely to, once they respond, it is done. And in terms of coverage checks, my colleague Peter Darby will talk to you a bit about how we're going to quality assure our census, including our coverage checks. She's presenting tomorrow night, but we do run a coverage survey. And that coverage survey runs right after census to understand the quality of the information collected. And it is too early to say what the quality is. We are looking at the counts at the moment, and the counts are looking okay, but we haven't processed all the data. So it's just too early to understand if there have been implications for certain areas or questions, so item non-response. Peter will talk tomorrow about all the things we're doing so we can at least provide the best quality statements against each of the data items. And I think that's all my questions, Chair.
That's correct, Georgia. Thank you very much. Thank you, Australia. Let us move to Croatia. There were quite a few questions for Croatia. Please go ahead, Damir.
Okay. Can we see the questions, please?
Certainly, let me. If you go to the chat box, you will see the questions. But let me them address. The first question referred to the fact that the census date was 31st of August. And then the actual census operation started on 13 September. So the question is, why is the reference date 31st August if the enumeration did not start until 13 September? So that is the first question. The second question is, how did you provide hand-on experience to enumerators to use CAPI? And that would be for the time being. So please go ahead.
Okay, because of the epidemiological situation, which was deteriorated from day to day, we had to move our reference day till 13th of September. So that means that the main reasons why we didn't start on the 31st of March, that was I mean, usual our reference day for all previous censuses, and of course this was the reference day that we planned also for this year. But as I said, because of the situation that was worse and worse every day, we had to move this reference day from 1st of April or 31st of March to the 13th of September. How we considering the second questions, how we copy with the education of the enumerators and also I think with the application, copy application. Well, we had online education, and during online education we present all aspects of the copy application, which was very simple for the enumerators. That means that we have to have other education for enumerators and some different education for supervisors and coordinators, because the applications were different. Application for the supervisors and the coordinators is the CMS, and that means application which supervised or could have some who could govern and see what happens and monitor what happens with the enumerators. And enumerators also had simplified application. Also, it is not only simplified, but it's also very good view, and they had also tooltips which could inform all the enumerators about the methodological aspects of the questionnaires. That means in these tooltips you can see all the explanations about the some questions, so that they can also on the spot can see what questions and explanations of the questions. So this education lasted for 4 days, but only 1 day, a day and a half, spent to explain about the application. And that was, of course, the separate times that we knew that we have to do it. Even though the application was very simple, they have to practice on the application, and we did it, because we've got 2 environments of the application: educational environment and the real environment when the census is occurred or carried out. So on this educational environment, our enumerators could practice before the census started. So that means they had afterwards 10 days to practice in this application.
Thank you. Thank you. There is another question, Croatia, for you, and it refers to the matching of the responses from the PES to the census itself. So once you conduct the post-enumeration survey, after you finish your enumeration on 14th of November, then you will run your post-enumeration survey. Do you intend to match the records from the PES to the one in the census to assess the coverage and the quality of the responses?
That's right.
Please.
Yes, that's right. That's absolutely correct. After the census and after the post-enumeration survey has done, we have to match this both. I mean, surveys between the census and the data of the census and the data of the PES. and see how many people are covered or not, and of course what is the under coverage, over coverage, quality of certain questions, and so on. So that means after we will have two different bases, and we compare the addresses, the dwellings, also the persons by the ID number of the person, so that we have procedures that we could find all the dwellings, all the persons, and all the households. And of course, then we will match and see and calculate the overcoverage, undercoverage. We will use probably will use dual method of estimation, and of course we are thinking of using a triple method of estimation. We will see about that after the processing that.
Thank you very much. Thank you, Croatia. Are there any other questions or follow-ups for any of the three presentations that we have heard from Australia, Chile, and Croatia? I do not see any at this point of time. Of course, should you have anyone, please use the chat box, and then we will certainly make sure that we provide all the informations and the responses even later on. Can I please ask all the participants to mute themselves? Thank you very much. Now, let us then move to the next batch of three presentations from India, Italy, and Portugal. India, are you ready to take the floor and share your screen? India?
Hello everyone. Yeah, I am from India. Just a minute. Is the presentation visible?
Yes, it is.
Yes. Yeah, good evening, everyone. I will talk about the changes we have done in our census procedures to reduce the impact of COVID. Our census is not yet started, but we are planning to start it soon. The original calendar of our India was we have the census in two phases, house listing and housing census, and the second phase is the population enumeration. The house listing and housing census was scheduled to be done in April to September 2020. We were just about to go in the field for this census when the pandemic started, and we have to keep on hold all the activities. And the phase 2 was scheduled to be 9 to 28 February with reference date of 1st of March 2021, and 1st to 5th March was our revisional round. So due to COVID outbreak, we just kept on hold all the activities, and just we are we kept in mind that due to the COVID outbreak, it is not going to be it will not be possible for us to go for data collection in the field so rapidly, and it may be cases that many of the people don't respond for the when we go for face-to-face data collection. So we tried to make it more and more digital. So we are going to collect data through mobile app. It was planned earlier also, but now, but at that time we planned that we will give mobile option as an option, and we will also use our paper schedules as well concurrently. But after that COVID thing, we thought that paper schedule will not be so much safe. So we just planned that paper schedule will be used only and only in the case there is some connectivity issue. Otherwise, use of mobile app will be mandatory. And we also planned for the self enumeration for our both the phases. And we have also made a strategy for wide publicity, so that more and more people go for self enumeration first, and the window of self enumeration will be open before this we go for actual field work. In case some people are not able to self enumerate themselves, then our enumerator will go as per the schedule in the field, and they will go for enumeration, the normal traditional kind of enumeration, but through mobile apps. We are also doing all the monitoring activities through Cmms Portal, so that among the official also not too much physical touch. And we are also planning to give training online as much as possible. It is regarding the mobile apps. In the mobile apps for house listing and housing census and population enumeration for both of the phases, we are doing using the mobile apps, and also we are giving window for self enumeration. Both the windows for both the self enumeration of both the phases will be different. In our case, we actually planned discussed about the possibility whether we can go for any change in the time schedule and all, or merge both the phases together due to COVID pandemic, as it got delayed. But after huge discussion among ourselves, we found that it is not feasible to get reliable data when we disturb our time schedules, because being a vast country and different geographical conditions in all the places. Some places flooded in some seasons, some places snow-capped mountains. So it was decided finally that we will not change the time frame. Rather than that, we will just going to change the year. Further, there is difficulty in our census that our app is in 16 languages. That is also a problem in case of self-enumeration and mobile apps, but we got all the activities were postponed and we got a huge time, so we utilized this time in developing application for all these languages, and even in self-enumeration portal also we are providing most of the languages. Further, since there may be connectivity issues in many of the remote areas, keeping this in mind, we developed app. Our app is working in such a way that in offline window also it works fine. But for the first time, when a user registers, the enumerator registers, then in that time the connection will be needed, internet connection, and internet connection will finally be needed at the time of submitting all the records. This is our Cmms portal. We are functioning of where all the enumerators will be registered, and all the training records will also be in this portal, and also all the logistic management, where printing material has reached or not, and how much enumerators filled in which mode the schedules, and what is the progress of the filling of the schedules, etc. That all will be managed through this. Even the on-area management will also be through the portal. These are our questions for housing census. which include questions on housing condition, household information, amenities available, assets process, and other questions like main service consumed, and the mobile number. Mobile number we are basically taking for self-enumeration in the second phase. And we could not take effort to change the questions in view of COVID, because all our material is already printed, because we were just about to go in the field. So keeping in this view, we are not thinking about further change in questions, because whenever we will change the questions, we have to go in the field for testing first, and we believe that we do not have time. Once we are given green signal to go in the field for the census, we don't want to waste the time and just want to go for the actual census task. These are the population enumeration question, which contains demographic, socio-cultural, economic, and migration things. Most of the things that are it seems in view of COVID, like date of birth and place of age, etc., or children born within 1 year, that are already in our questionnaire, part of our questionnaire. So we think there is not much issue in case we don't make change in the questionnaire. This is a glimpse of our portal where we can see the progress. And this is about the data dissemination that we are now this time planning that after the census is conducted, so we may provide the customized data also to our portals itself. And we have put the many mobile many validation checks also inbuilt in mobile apps. That is the beauty of the digital data collection. And one more thing that we decided is we are not going to purchase tabs or mobiles for this task, because being a huge number of enumerators and keeping in view the huge cost constraint and then procurement of the devices, what we devised is that enumerator are going to use their own devices, and after use of their own for use of their own devices, we are giving them some incentive for using the digital mode. For training also, we are it is 3-tier structure of training. We have developed many e-learning modules and face-to-face training also, but rather than face-to-face training, we are also going to emphasize on e-learning module itself. We are also planning for geotagging of our enumeration blocks, and we have developed in-house mobile apps for this task. All the supervisor will go to the fields and they will geotag the entire area, the boundary of the area. We also ensure the data security on mobile or during transmission of data from the field. And what we are expecting, our expenditure is 8750 million expenditure. On honorarium part, we are going to give 57%, and on training 13%. For assistance to state in this task, it is 9% of the budget is going to be done, and publicity purpose, it is 4%. Thank you, everyone.
Thank you very much. Thank you very much, India. This is really another example of the major switch that is caused by the pandemic in the approach to the censuses, and the change of the methodology from mainly paper schedules to the using mobile apps. Thank you very much for this illustrative example from India. And then, of course, we will have opportunities to address the questions that are already few in the chat box, but then we will get to back after we hear from Italy and Portugal. So let's move to Europe now. Italy, please take the floor and share your screen. Thank you, India. Mr. Gallo, we cannot hear you. Mr. Gallo, we are seeing your presentation, but we do not hear you.
Sorry. Good morning. Can you hear me?
Now, yes.
Okay. So you haven't listened anything from the beginning?
No, no. If you can please restart with the cover page. Thank you very much.
Okay, I'm sorry. Now you see everything, also my presentation, right?
That's correct. Yes, we can.
Okay. The Italian permanent population census started in 2018, the first cycle, and it should be done the last annual survey in 2021. But in the 2020, the survey were cancelled, okay, because of the pandemic crisis. The population-based register is at the core of the Italian population census, together with the statistical base register of addresses. So at the beginning, according to the original plan, we have two different surveys to measure the coverage errors of population-based register, and also to collect the data for variables non replaceable or only partially replaceable. So we have the aerial survey, which was conducted on a sample of addresses, and a list survey conducted with a mixed mode technique on a sample of household coming from the population register. The population register represent, according to the dual system estimation model, the first capture, and the second capture, which is an annual sample survey plus administrative size of life derived by integrated administrative database, represent the second capture. Aerial survey and list survey plus administrative science of life for measuring the coverage of population register would be are applied to each municipality and each individual profile to correct the population register. And the ratio between the coverage, the over coverage, and under coverage, the ratio between these two components define the row corrector, which is usually applied every year to the population register. So we compute direct estimate calibrated for over and under coverage for each profile and for each municipality, and indirect estimates according to small areas models. At the end of the process, a weight is applied to each individual which is included in the population register. Because of the pandemic crisis, the 2020 survey had been cancelled. So, and in any case, according to the permanent census design, we will release by the end of 2021 a population count in any case by using a massive use of administrative data. According to the raw corrector, we identify some weaknesses. In particular, we discovered a controversial interpretation of some of the outcomes registered during the survey monitoring system, because some non-responded households are wrongly classified in the raw corrector. Also, the sampling sites not allowing to calculate correctors by municipality, sex, age class, and citizenship. And this is another issue with high impact on the raw corrector. And due to the methodology applied for the correction of population register, another weaknesses is represented by the fact that we don't have heads at the end of the process if we use raw corrector, and the two components, the ratio of the two components of over coverage and under coverage. For this reason, the pandemic crisis had accelerated and anticipated the use of administrative data 2020, but also for the new cycles we are implementing from 2022 and over. So this was in any case also foresaw since its formulation of the permanent population census was adopted when Italy changed its paradigm in census. The exploitation of a massive use of administrative sources was foreseen in original plan. So the National Statistical Office of Italy construct a thematic database called AIDA, which is the Integrated Archive of Usual Resident Population, since 2015, with the aim to exploit the administrative sources and to find relevant patterns useful for population count estimation at micro level. So with the aim to operate, to compute heads and not weights. At the same time, the aim is to improve the quality of municipal population register and at national and local level. So each presence of individual in administrative source, like labor or education register, tax returns archive, earnings, retired, and non-pension benefits archive, permits to stay archive, could provide sign of life, which are classified according to patterns or duration of stay in Italy. Also we are able to classify these patterns according to specific source and the association with other individual records, for instance, like household relations. We also worked on a definition of signs of life in the last 2 or 3 years. This definition have been also showed at international level, at international meeting in UNI's context. Administrative signs of life refers to activities performed by individuals from which a durable period of time, for instance, a year, and a place, for instance, a municipality, can be clearly identified. Be self-employed or working for a business, being a public employee, having a regular rental contract on a dwelling, or attending a school or university are examples of direct signs of life. On the other hand, we have also indirect signs of life, which are defined as those situations that identify a status or a non-professional condition. For instance, people with universal income, pensions, or children or other relatives as dependents in tax returns. Linking the records of population register with AIDA signs of life and survey data improve the estimation of under and over coverage of population register data. So the administrative data have been used to calculate under over coverage errors of the population register and estimate the 2020 population count. And we used the deterministic criterion to identify, to determine under over coverage using the patterns of signs of life at individual or household level. And I show you also the time window that can show in a simple manner, which is the idea to construct the pattern of the continuity patterns of signs of life. For instance, the blue area represents a classification of strong signs of life, because the pattern here of presence is realized, carry out at least 1 year if we observe 24 months, starting from the 1st of January 2029 and the end of 2020. And we also are able to identify weak signs of life which are not useful for the to define the usual resident population, and or signs of life not useful because there is a strong discontinuity before December, before the reference date of the census. And the household criteria to evaluate the national under over coverage of population register works on no signs of life to define national over coverage at individual level in a multi-person household, or also for one person household. So we look at the family, at the household context when we define the national over coverage at local level to identify indirectly people who don't have sign of life, but in the context of the household, they are under 14, for instance, old age, so they should have in the population register some parents, some relatives, and by default we define their presence in Italy looking at the context of the family, because they are people with 14 years of age, so they should have indirect sign of life among their household. And also for individual not in population register who are eligible to under coverage, we look at the signs of work or study for at least 12 months over the relevant period. And we also look if these people are owner of a dwelling or they have a rent contract. And the other condition is do not consider the no border municipality, because of people are cross workers between Italy and Switzerland and Slovenia and France and so on. At the end of the process, we identify for 2020 population counts a usual resident population by considering people correctly reported in RBI according to the population register, according to the independent signs of life coming from other administrative source, like those source from coming from education register or labor education. And we identify also 300,000 more of national under coverage. Most of them are foreign people with permits to stay in Italy, but they are not registered in the population register. 300 and over 1,000 people who are usual resident in Italy, and they are not registered in the population register. This kind of people, usually we are not able to find if we use as data collection the survey. This is another particular indication coming from the Italian permanent population census. We identify also 1 million people with no sign of life in Italy. So according to our idea, not all of this population might be abroad. More of them are without signs of life because they are unemployed, a long time unemployed, or they are NEET, not in education, not in employed, and so on. So we have to check with more in depth this group of population by using maybe new sources to better understand how many people are usual resident or not. So, conclusion, the 2020 population counts produced using the signs of life at the end of the process show the same municipal population amounts as those obtained if we use survey corrector in 2018 and 2019 waves. We have the same amount of population also at local level if we use administrative data or the sample survey. The composition by citizenship of the under coverage surveyed in the 2018 and 29 2019 waves is completely different, because as I told you before, administrative data collect more information on foreign people who are engaged in a job, and they are not recorded in the population register. We identify also some gray areas, subpopulation, or municipality with specific characteristics, which requires an in-depth analysis to verify specific patterns. And for 2022 new census round have been planned a new strategy which emphasizes the administrative data in the same way as I showed you now, but according to new, relevant, and significant measure to improve quality and accuracy of counting people with signs of life. So we are now investigated new techniques that use survey data to improve some signs of life, latent class models and other data science methods, with the aim to improve the use of administrative data and to obtain more quality and accuracy of counting population with signs of life. Thank you very much for your attention.
Thank you very much, Italy. Thank you, Gerardo, for this very comprehensive overview of the permanent census, population housing census in Italy. It is indeed very interesting to see that even if we rely very much on the administrative data and the advanced statistical techniques, the impact of COVID-19 had been felt even in those circumstances. So thank you very much for this presentation. And then we are moving to Portugal. Portugal, would you please take the floor and share your presentation?
Thank you. Are you seeing my screen? No.
No.
And now, are you seeing my screen?
Yes, now it's fine.
Okay, thank you. So good morning to all, or good afternoon. It's a pleasure to be here to share the Portuguese experience in 2021 census. Our presentation will focus on 4 main points: the 2021 Census Action Plan, the contingency plan developed for COVID-19 pandemic, data collection strategy, and some data collection results. The Portuguese census took place in April 2021 during the pandemic. Since the beginning, the strategy for 2021 census was based on 4 areas of innovation. These aspects were defined even before the COVID-19. The utilization of an address list for the first time, the traditional process of door-to-door distribution was replaced by the delivery of a letter with the necessary information to respond online. The second area was the internet as the main channel to respond to census. The internet data collection was introduced for the first time in 2011 census with success, and for 2021 the intention was to achieve a significant increase in this response rate. A winning strategy, as we will see later in the presentation, was successful. The reinforcement, the use of technologies in the field work was another area of innovation in the Portuguese census. All the field work was made through mobile devices, and we used the strategy of bring your own device. The majority of mobile devices belong to census workers. And the use of administrative data is the last area of innovation in 2021 census. All census planning and activities was focused on two major strategic goals: a digital census with a digital data collection and a digital fieldwork, and an inclusive census where all count and where we have to count on all. The COVID-19 pandemic had a significant impact on the preparation of the 2021 census and on the overall Statistics Portugal activity. The census program include a pilot survey was planned to April 2021, 1 year before the real operation. However, due to the COVID-19 lockdown in March of 2020, all the fieldwork in all statistics operation was suspended, and the pilot for Census 2021 had to be cancelled. With the pilot survey suspended, the evaluation of a change in the schedule of the Census 2021 was deeply analyzed. The Statistical Council, through the section for 2021 census, which is a body responsible for advise Statistics Portugal, recommended that Statistics Portugal should study all the possibilities for conduct census operation in 2021, or if not possible at all, prepare a postponed plan for 2022. Considering all the possible difficulties or obstacles that may be observed also in 2022. Statistics Portugal look for alternatives that would allow maintaining the operation in 2021 and finding ways to mitigate the risks that the operation implies in the current epidemiological context. For Statistics Portugal was essential to ensure the availability of information and to respond to needs of society and also to respond to European compromises. Census 2021 execution comes after a rigorous analysis and definition of a contingency plan in order to guarantee the census quality and to prevent risks for population and census workers. The main factors of the contingency plan was the replacement of the pilot survey by a smaller test that was conducted in November 2020. This test was the last stage of the preparation for the 2021 census, and its main goal was to test the collection process and the systems that support census operation. This test was already carried out in COVID-19 epidemiological context, according to guidelines issued by health authorities. Was like a proof that census was possible in a pandemic context. Other measures was the definition of a public health protocol to be applied in the various census phases in the context of COVID-19, the reinforced the option for internet collection, the introduction of the possibility to respond by telephone, and the adaptation of the communication program and improving mechanisms for controlling fieldwork. So one of the measure was the public health protocol. And this was very important to define all procedures that ensure to minimize face-to-face contacts was applied. The recruitment and training sessions was carried out using video conference systems, and some of them was in a hybrid model. Letters with response codes and passwords should be replaced in mailbox instead of being delivered personal. More measures in this public health protocol was the utilization of personal protective equipments, and whenever there was a need for contact with population, the enumerator have to observe physical distance and all the procedures that related to hand hygiene and permanent use of mask. Another measure, the reinforcement of the option for web collection. Although it had been planned from the beginning, where we had to reinforce the strategy for internet collection. It was the safest method of data collection and allow us to mitigate the contact between the population and the enumerators. This is an image of our online questionnaire. Then another fundamental measure was the introduction of CAT. There was a need to add this new mode to complement the internet option. This option was essentially to population groups that will have greater difficulty in responding via internet or with no possibility to face-to-face contact. This represents an increase on budget and was scaled for epidemiological situation with restrictions. So we have to reinforce also the helpline, the dimension of the helpline to be able to respond to a more complicated situation in terms of COVID-19. We also have to adapt the communication program to the public health context, and then a strong focus on internet response. The answer online is safe in both ways. We develop and explore a lot of partnerships with all sectors of society in order to make the census a special project in special time. The local authorities and the local communities also played an important role in this chapter. Then the control and evaluation program, the quality and evaluation program for the census 2021 comprises two major areas of action. One is the control of the production process that comprises the implementation of mechanisms to verify and control some of the census process, like training, field work, or edit and imputation process. And the other is the post-enumeration survey. We are currently conducting the post-enumeration survey, is our 10 week of collection in this also finishing. Concerning the mechanisms for controlling fieldwork, we have what we call alert indicator system. That is a system which consists of monitoring in time counts of persons and dwellings by comparing them with expected values who are obtained from administrative data. Whenever deviations are detected below or above the limit defined, it is activated additional checking procedures by the census structure. This checking procedure, more than requiring a major attention from regional or local executive structure, has enabled to control and to prevent eventual coverage errors that might be happening. Another process used to guarantee the quality of the fieldwork activities is a quality control of answers. In this second process, is defined a systematic sample of 5% of dwellings that are re-interviewing by the local supervisor. Is checked 3 questions: address, occupancy status of the dwelling, and the number of residents in the household. The administrative data support was another important aspect for data quality. And in this epidemiological context of COVID-19, the use of the administrative information was even more relevant and allow us to improving the quality of the address list from the integration of administrative data and updating the occupancy status of dwellings. That is a fundamental variable to increase the effectiveness of the fieldwork. To improving the population count by making available population estimates that I referred as the warning alert indicator system. The reinforcement of data validation process and data consistency analysis, increasing the quality of census results. And the last one, the possibility of assist in the preparation of contingency actions for different advertisers that may comprise the census response. The possibility of having administrative data that characterize the population if in certain areas or for certain households is not possible to collect data through census. Fortunately, the pandemic was not so bad in April and this plan was not necessary. Now I pass the floor to my colleague Almiro that will talk about the data collection process and some results of the data collection process.
Okay, thank you, Paula. Are you listening me? Yeah?
Yes.
Yes,
Okay.
yes, please go ahead.
So, thank you, Paula, from this sharing presentation. Like Paula said, my name is Almiro Moreira. I'm the Deputy Director of Data Collection Department and Management from Statistics Portugal, and I was the National Coordinator of Census 2021 data collection. So I will start for thanking for all of you this opportunity for talking a little bit of our data collection in Census 2021. And I will start for the data collection timetable. Like you see in the figure, we split our data collection timetable in 3 phases. Let's go to the next one. That I will explain a little bit in more detail in the next slides. And in data collection team, we are around 15,000 staff members, including 11,000 enumerators that were involved in our data collection. So this is our chain of control of Census. Census office is coordinated by Paula. And then we had the data collection national coordination, then a regional level of coordination, and then municipality and parish level of coordination, and then the enumerators. We also have, from the beginning, a tech support line, and parish support desks. So this is how it looks like our team. And then in the data collection phases, the phase 1 that we call the distribution phase, from April 5 to 18 April, all dwellings receive a letter with a unique code and password to answer by internet or telephone, and they were distributed by the enumerators without personal contact with the population, like Paula was referred. In this phase, enumerators also made the housing census and confirm or correct the address, add new buildings, deleted no existing buildings, fill in the housing census questionnaire, because like Paula said, the enumerators come to the field work with a list of all dwellings that we have in the administrative data in our national databases of addresses. And in these phases, no questionnaires paper were distributed. This phase 1, we have 2 weeks for the distribution, and in these 2 weeks, we 6.2 million of letters was delivered by the enumerators in only 2 weeks, and the letter is look like this. You can show on your right, I think. And then the second phase from April 19 was the census day to 30th of June, and the web questionnaire was available to reply from 19 April. And we recommend an answer as soon as possible, and in preference by 3rd of May. This phase was very successful, and in just 2 weeks we had 5.6 million of dwellings registered, and 9.4 million people registered, and it's around 19% of the total population in Portugal in just 2 weeks. So doing this fantastic adhesion that also surprised Statistics Portugal, we anticipate the remain lighter by 2 weeks from 13th of May to 4th of May. And this is look like this reminder letter to reply. And then from end of May to end of June, we start the microdata analysis and collecting the missing answers. In fact, the web questionnaire was closed on 12th of July. And this is the phases of the data collection. And now I will show you a little bit, and in a very quickly way, the tools that we used in Census. And I will start by the e-recenseador in Portuguese, e-enumerator in English. And this is it's an app that works online and offline, and was installed on the enumerators on devices. It was available in the Apple Store, Google Play, and the Huawei Store. And this is how look like the main screen. This app allowed to the enumerators for each geographical area of work, associate the letter and the calling to a dwelling, georeferencing all buildings, list all buildings and dwellings, add new buildings and new dwellings that they checked in the field work, correct buildings and dwellings data, make, if necessary, some schedules of appointments with the population for a later visit or something like this, and synchronize also the data collected offline, and also receive a message from the data collection structures. This message service, it was very useful, and allow us to contact with the enumerators in a very efficient way by sending informative message or operational messages. The app also allow to the enumerators georeferencing new buildings and the correct the position of the existing buildings. And this is look like the list of dwellings and the state of the progress of which one, that all in the beginning, all dwellings and the whole buildings are to start with the red point, and then they change to in progress, and then when they have the whole answers, for instance, the whole answers from an entire building, the building pass for the color green, and they can look easily how the schedule, how the work is on the field. The app also add a lot of a significant number of actions that are adapted to the state of response, like edit address or associated code or giving a respondent support, and this is how look like these menus. We also had back office web applications that allow us to have the status report every day to check how the field work was going on. Also to some microdata analysis report, the allocation of geographic areas of work, to manage the recruitment and the payment of the whole staff members, and the DSX are always according to the staff profile. And to finalize, some figures about the response mode. 99% of the replies were made on an electronic way. Only 0.41% was made by paper and 0.28 by telephone. If we want analysis in the deep way, the electronic reply, we can split this in 3 ways. 88% was given directly by filling our website, like Paula shows. And then 8%, about 8%, it was responded by the respondent support in the app that the enumerators had. And 40% was collected in the parish support desks. So, like I said before, we had a fantastic addition from the Portuguese people. And in the very first days, we collected the majority of the replies, and we closed the data collection with 99.99% of all responses, and only about 6,000 of dwellings of around all the country refused to reply. And this allows us, Statistics Portugal, to disseminate the preliminary data in less than 4 months after the census day. So, obrigado. And if you have some questions, I don't know if you already put questions in the chat that I can see when I'm presenting, but okay, we are available. Me and Paula. Thank you.
Thank you very much, Mr. Moreiro, and thank you for yet another illustrative example of the adaptations that Portugal took in order to comply with the measures mitigating the impact of the COVID-19 and the obvious satisfaction how this CAVI approach worked in Portugal. Thank you for this illustration. So we do have some questions here. I'm now opening the floor for the questions to India, Italy, and Portugal. I would just like all of us to be mindful of the time. We do have another 2 presentations to go. So I do have some questions here in the chat box. Question for India with 3 different responses routes, mobile app, paper questionnaire, and self-enumeration. Have you assessed the extent of potential mode bias? So that is the question for India. And then we have a question for Italy. The methodology for assessing coverage in the new Italian permanent census is not always easy to understand for the user. Does ISTAT have evidence that the users have confidence in the quality of the data? For Portugal, what sources of administrative data were used in the census and for what purpose? Some of it, I think, it has already been responded in the presentation, but still. And then I am now opening the floor for any other questions for India, Italy, and Portugal. So the floor is open. I see no hands raised, so would you please then address the questions? Suchita, India, please go ahead.
Yeah, regarding the bias, we have already tested the bias in mobile application and paper schedule in 2019 during our pre-test, because mobile app was already pre-decided for us. Regarding self-enumeration bias, we still need to test it before going in the field. In-house we have already tested, but in the field we need to test.
Okay, thank you.
Yeah, and regarding the coverage issue, that what we are going to do, there will be no issue in the coverage, because what we are devising for self-enumeration, whenever our people will go for self-enumeration to any house, so when some household will self-enumerate itself, it will be given a reference ID, and that reference ID is to be saved by the household itself. And our enumerator will go to each and every house during field visit. And in case some household have done the self-enumeration, enumerator will collect that reference ID. It will not canvass all the questions, but will write the reference ID in the respective places. So it will ensure the complete coverage and no omission or duplication.
Thank you. Thank you very much. Gerardo, Italy.
Yes, thank you to Jan White for the question. And I write almost everything in the chart about the bias or the quality, the accuracy of population counts provided in 2018, 2019 by using survey data. Well, if we consider the design of the Italian permanent census, the efficient of estimation are very good at provinces level and also in the biggest municipality, because we have direct estimation coming from these domains. When we go down to the smallest municipality, the efficiency of the estimation could have some bias. And in any case, we provided interval confidence to all municipality, for all municipality in both ways, for 2018 and 2019. With reference to 2020, we are not able to provide any kind of measure of quality, because we used for the first time administrative data for population counts. That means that we have now two difficulties to face. The first one is how count the population for 2021, and we are discussing with methodologists, which methodology staff, which is the main way to do that. The second point is how we go beyond the 2021 when we use for in massive way the administrative data for population counts. In this context, from the new cycles of the Italian population permanent population census, we are well confident that the aerial survey should be used to provide quality and accuracy measures of the Italian permanent population census, because this is the challenge for the change of population census in Italy. The problem is to provide quality measure in producing population counts. For the first cycle, we are well confident that for medium and larger municipality, the estimation of population count are well done. Some difficulties are when we go under municipality with less than 20,000 inhabitants. Okay. So that's all.
Thank you. Thank you, Gerardo. Thank you, Italy. There are two questions for Portugal and one question for India. I would appreciate our colleagues from Portugal and India to reply to these questions using either the chat box or the email.
Okay.
We are running a bit out
Okay.
of time. So I would appreciate very much if you address those questions and then make sure that the responses are provided to our colleagues. I hope you agree with that.
Okay.
Thank you very much. Let me then move let us move to Africa, and let's hear from our colleagues from South Africa and Zambia. South Africa first, so please take the floor and share your screen.
Greetings to everyone. Is my presentation showing?
Yes, it is.
Okay. I will be taking you through South Africa's presentation. I've got my colleague, Nozipho Shabalala, who would also then be leading on questions and answers. In terms of preparations for the census in South Africa, initially we had our plans to undertake the census in October of this year, as depicted in the Statistics Act, but of course COVID came in and quite a number of plans had to change. This is just a brief refresher of census takings in South Africa since 1996, and the fact that the current act still talks to undertaking the census every 5 years. However, since 2001, we've been undertaking census every 10 years, with the intercensal survey, community survey in between in 2007, as well as the last one in 2016. In terms of, this is just also a recap to indicate that we were mainly doing PEPI collections since 1996, as well as 2001 with the introduction of the scanning technology. And then in 2011, we still did census using PEPI as well as scanning technology. However, for 2022, our plan has been to roll out the CAPI collections, and then those have subsequently changed. We are just here affirming that the 2022 would be very different from technological usage, as well as geospatial information, which brings faster and more efficient as well as better quality product. In terms of the disruptors, the biggest disruptor has been COVID-19. And in the main, we are also looking at how best do we ensure that we still bring a credible count to the nation. Our problem statement is, let's say, like many other NSOs, is being challenged to introduce other alternative collection approaches in a form of web-based self-reporting as well as telephone-based interviewing techniques, while of course we still rely on our CAPI collection, which is mainly what has been tried and tested over time. Then this also just shows that with the COVID environment, we are expected, of course, to be adaptive and be agile in our processes. We are expected to do more with less, respond to the COVID environment, while at the same time using or embracing technology in trying to respond to the pandemic, and of course use those as building blocks for future collections in NSO. Of course, we are moving in earnest. To date is 91 days towards our planned collection date, which is February the 2nd. And our priority objectives still remain maintaining adequate coverage of the target population, ensuring completed questionnaires and item responses, guaranteeing overall quality of the data collected, maintaining timely data collection, processing and dissemination, minimizing response burden while having an auditable process to aid data validation, as well as data confidentiality and security at all times. In terms of the use of technology and geospatial information for our 2022 census, we will, of course, be using the multimodal data collection. We'll be deploying the Kawi collection, the Kati collection, as well as the CAPI in this regard. Just to share with you the high-level process flow to date, we started in earnest in 2018-19 financial year, where we did quite a number of tests and review. And as I was indicating at that point, we were still of the view that the CAPI collection would be the main and only mode of collection that we'll be releasing. And of course, as we went about reviewing, COVID came in and it changed all our plans. We then had to introduce both the Kawi and the Kati in the main to aid the restrictions that were brought in by the various levels of restrictions brought on board by the COVID. This is just also a process flow of the various collection modes that we intend to deploy. And I think members can still be in a position to look at that in their time. But we, in the main, emphasize that publicity becomes the key to our pre-enumeration processes, as well as questionnaire design and management, while also taking into account admin data to aid preparatory processes. Of course, innovations that then were brought on board in the main by this COVID is the, first of all, our recruitment process, which had to be electronic, where we invite members of the public to apply electronically to be field staff in the census. And of course, as they do so, they then interface with our geographic information frame to select area where they reside, because our aim is to appoint people within their area of residence. And that, of course, feed into our logistics processes, both forward and reverse, and also our budget tracking system, while at the same time, the learner management system track progress of each trainee that is brought on board. And incorporated into that would be our mobile device management, which also tracks not only the devices as and when they are used, but also in real time does show the collections as and when they happen in the field. This is just another depiction of what I have then talked to earlier on. And this also just demonstrates the interface that then the members of the public would have with our recruitment database, which then interfaces with Google Maps, and people select the area where they reside. This is a dashboard that then, once people have applied, continuously inform management team on progress that is being made from a recruitment point of view, so that then we could also target areas where we are not seeing any applicants coming through. And digitizing our maps, of course, we are looking at issues of multi-dwellings and allowing members of the public as they register to also unpack some of the structures within their dwelling, so that we could determine whether there are multiple dwellings at a particular dwelling, or multiple households at a particular dwelling, so that then that informs the work allocation for our field staff. Our field staff using the Rather Copy app would also have an integrated navigation system that aid the field staff to move from one structure to the next. And of course, in terms of our collection approaches, is that our CAPI solution can only open the questionnaire once the field worker is 30 meters away from the geopoint where they need to enumerate. This is just also an rather depiction of our electronic questionnaire that then comes out as and when the field worker has reached their enumeration point. From a management point of view, we also have a dashboard which then continuously inform us of progress as and when field staff continue to enumerate members of the public, and we therefore use this to continuously then make interventions and support where required in the field. I just thought we could also share with you some of the publicity initiatives that we'll be rolling out to try and improve on the coverage when we roll out. In the main, we'll be having both or rather electronic as well as paper print medias, and we'll be looking at educating and exchanging of information with the public, continued stakeholder engagement with effective mobilizing gatekeepers, as well as use of both print and electronic media, while we also enhance on our outdoor advertising. The next slides just depict some of the publicity paraphernalia that we'll be using to rather garner support and educate members about the forthcoming census. These are some of the billboards that would be up. I must emphasize that at this stage, as we are preparing, we have not as yet started in earnest to roll out our publicity initiatives because of the local government elections that have just been concluded. Let me then share with yourselves the journey thus far. As I said, we did various tests starting in rather 2018, and we looked in the main, we were testing how the CAPI system that has been internally developed could be rolled out. And then we were then also then forced to then introduce the CAWI and the CATI and also adapt also our dwelling frame to also support the collections using both the CAWI and the CATI. And this collection modes, as we were preparing for our pilot itself, we were actually hit by heavy restrictions based on the level 4 restrictions of COVID, which in the main forced all Stats SA field related activities to be suspended. So as we were concluding our preparation for the pilot, the president announced a stricter level, and therefore the CAPI collection had to be abandoned. And our pilot then focused in the main for CATI as well as CAWI. However, as we were concluding then the pilot, we then also experienced further, or rather a relaxation of the stricter level of restrictions to level 3, which then allowed us to then resume our field interactions with respondents. And then we then had to adjust our collection period and added 14 days that would then aid the collection of the CAPI. Just to share overall outcomes coming out of this pilot, the structure and completeness of our data seems satisfactory. Our overall data is plausible. Quality of data is satisfactory. However, there are some cases that need further attention, mostly with regards to our validation rules. Some validations and edit specs have to be reviewed and finalized using these outcomes from the pilot. Implications on the questionnaire, questions on agriculture and food security seem fine. Questions on poverty-related indicators are also fine. Questions on demographic, around questions on age, fertility and mortality also worked well. However, further engagements to finalize our migration sections are underway. And then questions on labor as well seem to be fine. In terms of our baseline timetables, in the main, we are looking at collection happening in February. However, as we prepare for those, there are pre-enumeration, finalization of our frame update, as well as the start of our publicity and training processes. This just gives further breakdown, indicating that we have just opened our recruitment database here in October, and on the 3rd of December, we'll be starting with our national training, followed by provincial training in the 3rd of January, and then finally our district training, which then leads to the enumeration planned for the 2nd of February up until the end of Feb. And of course, we will only be limiting the self-enumeration CAWI for the first week, the 3rd to the 7th of February, then followed fully by the rollout of both the CAPI and the CATI. And of course, beyond that, there would be a non-response follow-up in March, with PES following immediately after the non-response follow-up. Main lessons that we have learned out of the pilot: less than 1% of households in our selected areas that participated in the pilot, that is using below the line publicity initiatives. That's what we saw as rather a response on both the CAWI and the CATI. Some members who registered thought they were registering to be field staff instead of completing the questionnaire. And even after nudging them for a while, we still didn't see a very good improvement in that regard. But mainly, it could be that also our publicity was a very low key. We have also seen that for us to see an improvement on the CATI and the CAWI, we require strong publicity strategy and initiatives. And of course, we need further education on ensuring that our households, as they do unpacking during registration process, do not leave out other multiple houses within the dwelling. And of course, these two collection modes are not conducive for rather enumeration of the homeless as well as the transient population. And of course, these collection methods require quite a stable based frame with contact details. And our pilot households, which we did not have prior contact details, became quite difficult to reach out to. But of course, CAPI still posed or gives us a better coverage and response from households. It also caters very well for all other population groupings. However, it is a resource intense and requires quite close monitoring. There are quite a number of risks that we have picked as well, and we have equally identified mitigation plans in that regard. The MDM, meaning mobile device management, being one of the key instruments that we use to remotely monitor and also manage the devices in the hands of our field staff. Going on key concerns, localized recruitment still needs special attention. Undercount in certain categories also requires special attention, especially farming areas and highwalled areas. Our multi-channel data collection has potential of some duplications. However, we have identified methods of ensuring that we can identify duplicates and then deal with them accordingly. We still have funding pressures that are there, which in the main have also been compounded by the COVID pandemic, which requires that we need to have PPEs for our field staff, which those were not originally budgeted for. And of course, the local government elections, which have just concluded, forced us to rather hold back on our publicity initiatives. And of course, there's also law compliance levels on the rule of law in the country, and people need to be continuously alerted and informed of the benefits of the census. And of course, there is the POPI Act that has also come on board, that people then become more concerned about security and usage of their information, and our publicity initiatives try to talk to those issues equally. But also the literacy levels inhibit the penetration using the Kawi method, as well as rather connectivity throughout the country does pose a challenge in that regard. Chairperson, let me pause at that in terms of briefing on where we are in preparation for the forthcoming. Thank you.
Thank you, Calvin. Thank you, South Africa, for this really very comprehensive overview of the preparatory process and the impact of COVID-19 in putting the finishing touches on the census. Let us move to Zambia, please. Zambia, can you please take the floor and share your screen?
Hello, good morning, good afternoon, good evening, everyone. Yeah, I'm trying to share my screen. Unfortunately, it's not here.
We can see a slide 4 of your presentation.
Oh, okay. Are you still able to see?
Yes, if you can put it into the slide mode. Yes, it's perfect. Please go ahead.
All right. Yeah, so I'm going to take you through a brief a summary of census preparations for Zambia. As people may have heard before, our plan was to hold the census last year in 2020, but that could not happen mainly due to the COVID-19 pandemic. So it was postponed to 2021, but then again, the pandemic was still there, and there is a proposal that the census is moved to next year, sometime next year, and the dates are yet to be announced. So this is just the outline of my presentation. Of the introduction, status of the next year census of population and housing, impact of COVID-19 on the census preparations, and plans for modifications in the design of the population and housing census. So Zambia has successfully undertaken censuses since 1964. The next census, like I said, will be undertaken in 2022. The date is yet to be announced. So this will be the 6th census that Zambia will be undertaking. So on the status of the next census of population and housing, we have done quite a lot in terms of preparations. So we have some pre-census activities that we have already conducted. We did questionnaire adaptation. It was a consultative process, started in 2018 up to December 2019. We also did cartographic mapping from January 2019 to September last year. So at the moment, the redemarcation of areas should have been completed by now. We had the pilot census in November and December last year. The evaluation of the same has been done, but I won't go into details of that. So various IT activities, including questionnaire programming, started in 2019, and these will still go on now that we have postponed the census. Then we have been having census campaigns, publicity campaigns from 2019. These will go on up to 2022. And then the procurement of some equipment, supplies, hardware, software. This is still an ongoing process. Due to the postponement, we could not finalize the procurement of the census stuff. And then the main census activities have all been moved to next year, 2022, when we have the census, as well as the post-census activities. So now we'll look at the impact of COVID-19 on the census preparations. During the pre-census activities, we've had challenges in terms of the census committees meeting regularly. So the planning was somewhat disturbed because of the COVID-19 pandemic. Then cartographic mapping was equally affected. The pandemic led to the increase in the budget for the exercise as PPEs had to be purchased. Also led to delays in completing the field work. At times, the field workers had to stop the exercise, and then again, later on, when the situation normalized, would go back. So there was an extension in terms of field work for cartographic work, which is the listing. The EA redemarcation exercise was also equally delayed. The was also affected in terms of budget because of procurement of PPEs. And finally, then the census itself was not conducted starting from 2020, this year 2021, when we should have been having one right now in November, because that was the scheduled month. So it was pushed to next year at a date to be announced. Modifications in the design of the population and housing census. On this one, we really don't have much, but there are plans that if the situation, the COVID situation will continue next year, then we have to make sure that the trainings are held virtually, because usually the trainings, that's where you notice that there are so many people come together during the training, and during the COVID pandemic, that's not really a good idea. So we are hoping to design the materials. We are not doing actually any printing. All the materials are digital. So we are designing them in such a way that if anything happens, the situation gets worse, we should be able to conduct virtual trainings. Then the materials have to be shared with the trainees way in advance so that they are familiar with them. And also, we're supposed to come up with an active learning platform for each census staff training so that we avoid individual contact during trainings. Then to broaden the scope of batting the spread of COVID, the plans are there to engage into partnership and collaborative efforts with partners. So the agents will collaborate with line ministries and other government departments to ensure fumigation of training facilities. This is in cases where the situation is at least normal and we are able to conduct physical trainings. People are able to attend trainings physically, that is. So we'll also be doing pre-screening daily. Screening of participants and certification of premises has to be done before the trainings start. Then again, as usual, following the guideline on washing and sanitizing facilities, all training venues requiring physical presence of census staff will have adequate hand washing facilities, sanitizers positioned in strategic places during the training. Face masks will also be provided, and most of the census meetings will be held virtually unless the situation requires that really people have to meet in person. Then quarantine measures for all staff testing positive. During field work, apparently, owing to the fact that our country relies so much on person-to-person interviews, I've listened to some of our colleagues' presentations, and they have got other mechanisms to use during the COVID pandemic. so as to reduce the spread. But in our case, it's quite tricky because mostly the other forms of collecting information might not work in our situation. So we are depending on the same person-to-person interviews, which is quite dangerous actually during the pandemic. So enumerators will be required to observe physical distancing at the time of collecting data from households. And also respondents will be encouraged to wear masks during the interviews. So that marks the end of my summary presentation. Thank you very much.
Thank you very much, Zambia, and thank you for this presentation about how Zambia intends to adjust the census activities based on the impact of the COVID. Thank you very much. There were a number of questions in the chat box, but there were also answers being provided to those questions. We are really very close to 11 o'clock, and I understand that we all have to keep our schedules pretty tight. What I would certainly appreciate very much is that, as was the case with Portugal, that South Africa and Zambia please do reply to the questions that are asked in the chat box. If there are additional questions for any of the participants that you would like to raise, please do so after the meeting itself by sending us an email or communicating with us in any other way, and then we will address those questions with the presenters so that they can be replied in full. I really believe that we had this outstanding opportunity to go around the world and listen to the adaptations that census takers, our colleagues, had to implement in order to cope with the adverse impact of the COVID-19 pandemic, and some of it resulted really in outstanding improvements in the way that the data are collected, and even exceeded, obviously, the expectations in quite a few countries, especially from the point of view of internet self-enumeration. And I believe this is one of the major messages that we can take from this round of presentations, and from the understanding that really the internet is changing the way that we are looking at the data collection techniques and procedures. What we have also can conclude from this really very interesting round of the expert group meeting is the fact that the COVID-19 pandemic is indeed universal, and it impacts all of the areas of the world in pretty much the same manner, and that this is not going to go away just like that. The consequences will be felt for a considerable period of time, and that this round of censuses may be indeed used to provide a snapshot, to provide a picture of a world in a kind of a turmoil and in a kind of a calamity mode. And the fact that the resilience of the census taking is still there, and the agility of the solutions that we have heard about and are provided by the census taker is, I believe, an excellent starting point for looking beyond the 2020 round of censuses and looking forward to the 2030 round of censuses from the point of view, of course, of providing accurate population counts. So with this, I thank you all the presenters. I thank you all the participants. We are, as you can see, we are having an outstanding audience. We are having a lot of questions going back and forth. Please do not hesitate raising again any question, any issues to any of the presentations using offline, so to say, facilities, and then we will address each question as we move on. Let me then conclude with just reminding us what lays ahead of us on day 3. Tomorrow we will start again at 8 o'clock. However, we will be opening the platform at 7:30 for all the presenters to test hooking up and running the presentations. We will be addressing session 5 and 6 tomorrow. Session 5 is on the assessment of the process quality and output quality for censuses conducted during the COVID-19 pandemic. Quality is of paramount importance, of course, needless to say. And we will again have countries presenting us how they approach this challenge. And session 6 is on the effects of the 19 pandemic on data analysis and comparability over time. Another very important point, given the fact that we tend to run a series of analyses, intercensal analyses that provide us the understanding of the dynamics of the population structures and characteristics. So this will start tomorrow at 8 o'clock. Again, the platform opens at 7:30 New York time. We will be running the countries' presentations from Australia, Canada, China, Hong Kong, SAP, Slovakia, United Kingdom, United States, and Latvia. So this is in the store for tomorrow. Until then, thank you all very, very much. Again, don't hesitate contacting us with any questions you might have, and talk to you tomorrow morning, New York time. Thank you and goodbye.
Thank you.